DOOF NL, Transforming Cancer Care. We're honored to introduce 3 individuals whose work is making a profound impact on cancer care and patient support. First, Julia Parsons, a social worker with the Mental Health and Addiction Services at NL Health Services in Stephenville. Julia is completing her Master's of Social Work with a focus on adolescents and young adults affected by cancer. Drawing from her professional expertise and her personal experience caring for her fiancé during cancer treatment, Julia is passionate about enhancing psychosocial supports and creating resources that empower patients and caregivers throughout the cancer journey. Joining her is Christopher Cutler, founder and executive director of the Heather Cutler Foundation. Following the passing of his mother, Heather Cutler, Chris established a national non-for-profit organization dedicated to advancing innovation, equity, and policy reform in pancreatic cancer care across Canada. His leadership continues to drive meaningful change in cancer care advocacy and innovation. Also joining them today is Rayah Vokey. Rayah is a 4th-year honors student in behavioral neuroscience at Memorial University of Newfoundland. Originally from Clarenville, Newfoundland, she developed a strong interest in rural medicine early in life. Through her volunteer work with patients at the Dr. G.B. Cross Memorial Hospital and residents at the Mahoney Manor, Rayah has gained valuable insight into the unique challenges facing rural health care delivery. She also volunteers with the Heather Cutler Foundation, where her commitment to improving access to care for rural communities align closely with the organization's mission. Rayah aspires to pursue a career in medicine and to continue advocating for equitable, compassionate health care for underserved and rural populations across Canada. Please join me in welcoming Julia and Rayah. I do believe Christopher is not here. That's right. Okay. Thank you.
Hello. Okay, so our proposal for the Innovation Summit was CareCircle Connect NL. So this is a digital platform connecting patients and caregivers in Newfoundland and Labrador. Is there anyone able to? There we go. Thank you.
So Newfoundland's cancer crisis demands innovative solutions. Newfoundland has the highest cancer incidence and mortality rate in Canada, and while clinical care within NLHS is strong, patients, especially in rural and remote areas, face practical, emotional, and informational barriers during both treatment and recovery. Specific groups such as adolescents and young adults aged 15 to 39 have unique developmental needs, and caregivers of loved ones experience intense time pressures and emotional strain. Despite advances in virtual care and the EPIC rollout, supports for patients remain fragmented and hard to navigate. 2024 projections show 640 new diagnoses and 280 new deaths.
So before we get into what this platform could look like, we want to provide, a real-life case study of someone who could have really benefited from a service like this that really connects people with their care team. So on the next slide, we have a case study of Christian. If we're able to switch it. There we go. So this is Christian. Christian is a 22-year-old from rural Newfoundland, newly diagnosed with lymphoma. He is moving out of his parents' house, settling into his first home, and juggling work, bills, and the excitement of independence. Then everything changed. He was suddenly thrust into a complex and fragmented healthcare system. His hematologist told him he needed urgent blood work to start treatment within the week. But when he called the local collection clinic, he was told the next urgent appointment was 4 weeks away. Confused and anxious, he found himself navigating phone calls, voicemails, and travel arrangements on his own. So at a time when he needed connection the most, Christian instead faced isolation. His care team was spread across multiple sites, information was inconsistent, and emotional support was limited. He was worried about how time off, work, and travel costs would affect his finances, But even more so, he was struggling to understand what came next in his care. In a system built for medical treatment, Christian's human needs, reassurance, clarity, coordination, were left unmet. So what we're hoping to, connect here is how Christian could have accessed a single trusted hub to see upcoming appointments, contact his care team, receive tailored plain language guidance about his diagnosis and treatment, join virtual peer support groups, age specific for young adults facing cancer, and connect with a social worker through secure messaging for help navigating travel, financial aid, and emotional supports. So essentially, instead of feeling lost between systems, Christian would feel held within one connected circle of care.
Alrighty, as Julia alluded to, we're introducing CareCircle Connect NL, which is, as she said, a cancer care platform that would connect resources, peer support, and care teams to manage the treatment, manage well-being, and empower patients. From fragmented care to connected support, the platform will include centralized resources and interactive support such as treatment information, side effect management, financial assistance, and travel or lodging support. While these things may exist individually, there's no one single reliable source for this, so that would help that. Moreover, peer support and moderated groups, piloted virtually, co-facilitated by a nurse and social worker. It would focus on education, coping, mutual aid, and anticipatory grief support. Lastly, Epic integration would ensure secure messaging, appointment management, and care team check-ins to reduce fragmentation and overall improve the continuity of care.
So this slide and the next slide is an idea of what this could possibly look like, in an app format that might be more accessible to users. So this proposal is supported by evidence. So essentially, from my perspective as a social worker, we can go to the next slide. I would like to incorporate things that social workers are getting referrals for now, but not everyone is accessing those services, whether it's not something they're comfortable doing or if it's just not accessible in their area. But it would include CBT-based tools, and other modalities such as acceptance and commitment therapy, which can enhance quality of life and help reduce emergency room visits, provide practical coping strategies for patients, and provide support for those experiencing fear of recurrence or other concerns post-treatment that they might not, be accessing one-on-one with a provider. As well as the platform is digital, so it does increase accessibility, especially for rural residents. And the aspect of peer support that we could incorporate it into it as well, could be really helpful for people going through cancer and our rural residents. Okay, and the next slide just shows, how this could potentially roll out. So phase 1 could be a static site of resources and tools. So this could be, symptom trackers, mood trackers, and then different types of informational resources, age-specific, based on, what providers are seeing right now. And then phase 2, we would like to implement pilot moderated virtual support groups. And then lastly, explore integration with Epic for secure communication. So maybe ways that patients can message their care team and get some timely responses to questions they may have between appointments.
In terms of measurable outcomes for all stakeholders, this would benefit patients, caregivers, and the NLHS system with trackable impact metrics. CareCircle Connect NL will help improve the quality of life and measurable health outcomes by reducing distress, enhancing adherence to care plans, and fostering resilience and empowerment both before and after treatment. CareCircle Connect NL would also reduce preventable emergency visits, minimize care fragmentation, and improve caregiver capacity, all ultimately supporting smoother hospital to community transitions.
And so the next slide just kind of outlines how this proposal is in alignment with the NLHS strategic plan. So specifically in terms of access, quality care, and health equity. So priorities 3, 4, and 5, as well as, digital first and innovation, building on existing family voices. So through this alignment, we can create a more integrated and responsive healthcare ecosystem. And then our last slide is just any questions or comments that anyone might have. Essentially what we wanted to do is, I'll just read the last quote. So cancer can change a life overnight, but with CareCircle Connect NL, patients and their families can access the support they need when they need it most. Thank you.